Hello, everyone. My name is Araceli Molina. I am the Certified Nurse Assistant Program Director and Professor for the Allied Health courses at Los Angeles Mission College. I am happy to be here with you and share some information regarding our different programs and what are the requirements. The topics that I'm going to be covering today will be the pharmacy technician certification, the health occupation certification, medical billing and coding, the certified nurse assistant and home health aide programs, and how to fill out the CNA and HHA forms and the program requirements. We're also going to touch briefly on the associate's degree in biology and health science. I'm also going to cover the internships and externships that are available towards these programs and the opportunities that you have available. But let me ask you some questions. What are your career goals or areas of interest when we're talking about healthcare? Do you want to become a medical doctor, a pharmacist, a dentist? Do you want to work as a technician, or perhaps you want to become a registered nurse? Perhaps your goal is to work in a pharmacy. We have the option of the pharmacy technician certification. This program is designed to prepare students for a career in pharmacy. Upon successful completion of the required coursework, the students are eligible to apply for the state California pharmacy technician licensure and are prepared to work in outpatient, inpatient, and home health care pharmacy settings. If you want to work in healthcare, but you don't know where to start, the Health Occupations Fundamental Certificate is another option. Why do you need the Health Occupations Fundamental Certificate? The students who obtain this certification are essentially employable upon their meeting the mandated course criteria and multi-skill standards. Healthcare students need to become multi-skilled workers, either for professional or technical employment. They will be expected to become prepared for work in an interdisciplinary environment where flexibility and job performance is expected. The certificate from Los Angeles Mission College requires the completion of 4 health occupation courses and 2 allied healthcare courses. I'm going to describe those now. The Health Occupations 62 is a course that covers the topic in hygiene, safety, infection control, basic client monitoring, basic first aid, therapeutic communication, and basic health documentation. For Health Occupation 63, we cover basic medical terminology, pathophysiology, pharmacology for the healthcare professional, and it basically teaches you how to understand the healthcare language. What do we mean by that? Perhaps you don't know what the word tachycardia means. What we do is we break down these terms into the Greek and Latin roots. One example would be tachy, meaning fast, and cardia, referring to the heart. So tachycardia will be defined as a fast heart rate greater than 100 beats per minute. In Health Occupation 64, we cover legal topics for the healthcare professional. This course provides an overview of the concepts of health and illness, cultural diversity, and legal issues that affect the healthcare professional. In Health Occupation 65, we cover the fundamentals of healthcare professionals. This course explores career options in the healthcare industry, healthy behavior for healthcare professionals, work ethics, professional resumes and interviewing skills, and the personalities of the healthcare professional. There would also be an externship during which our area employers will introduce students to direct and indirect patient care opportunities. The last 2 courses is Allied Health 21 and Allied Health 100. Allied Health 21 is a basic life support CPR card for healthcare professionals and is approved by the American Heart Association. Allied Health 100 concentrates in job application skills for the healthcare professional. This course essentially prepares you for job searching and interviewing. What if you want to work in healthcare or a clinic or hospital, but you don't wish to have direct contact with patients? LA Mission College offers you the option of taking the Medical Billing and Coding Fundamental Certificate, which I mentioned briefly. The certificate program includes um, areas in healthcare such as front office, entry-level medical billing and coding, and medical records management. The certificate program will prepare students in different entry-level job roles, including medical front office personnel, medical billing representative, medical coding representative, and medical records clerk. Perhaps you're asking yourself, what educational pathways do you need to follow if your goal is to become a nurse or medical doctor? One of the options that you have towards a registered nurse degree is starting with the Certified Nurse Assistant and Home Health Aide program. For this program, you will need to fill out the forms that I will cover later, and I will tell you about the requirements. Students can continue going to school and obtain their associate's degree in health sciences, then apply towards the registered nursing program, which is transferable to the four-year bachelor's degree in nursing. And so the students can complete their bachelor's degree in nursing and apply for the master's degree in registered nursing, or decide that they want to become nurse practitioners. So for the nurse practitioners will be different specialties, whatever the goal is, whether you want to do obstetrics, um, general medicine, and whatever the specialty that you prefer to do for nursing. Let's say that your goal is to become a doctor in medicine, but you don't know where to start. At Mission College, we have the choices of completing the associate's degree in biology or the associate's degree in health science. The associate's degree in health sciences and biology, either one, will allow you to apply for the four-year programs and obtain a bachelor's in biology, microbiology, physiology, ecology, or any other of the life sciences. Once you obtain the four-year bachelor's degree, you can apply to medical school or apply to doctorate in pharmacy or dentistry or whatever other um, doctorate specialty that you're interested on. Now let's review the stackable certificates that I covered. You have the Health Occupation Fundamental Certificate, the Certified Nurse Assistant and Home Health Aide certifications, which allow you to start working in the skilled nursing facility, hospital setting, rehabilitation centers, or you want to do home health aid, which is a one-to-one service. You have the option of the medical billing and coding certification. You can continue going to Mission College and obtain your associate degree in health sciences or an associate degree in biology. These are all transferable to the four-year universities. Other options are the basic pharmacy technician, the associate degree in pharmacy technician, the biotech assistant, which is completed in the first semester, and you can continue going to Mission College to obtain your biotech research lab assistant. Then complete the requirements for the associate degree in biotechnology, and you qualify to start working in quality control. Now, as I mentioned, these are all transferable for the four-year universities to obtain a bachelor's. The different bachelors that you can apply for are bachelors in healthcare administration, bachelors in radiology sciences, public health, bachelors in registered nursing, kinesiology, environmental and occupational health, nutrition, the biological sciences, or you can also apply for the bachelor in pharmaceutical sciences at UC Irvine. As I mentioned before, these all allow you to get a bachelor's degree in the registered nursing program. Once you obtain the bachelor's on any of these sciences, you can apply to medical school. So the prerequisites for medical school has to be a bachelor's of science in one of these disciplines. Now, when we're talking about the Certified Nurse Assistant Program requirements and forms, we have the Allied Health website from Mission College where you will go under Allied Health. Then you will select the links that are for the nurse assistant and home health aide. Look at the enrollment forms. Once you select the enrollment forms, you will have access to all the different requirements for the program. One of the requirements is that you obtain a physical assessment. You need to obtain a proof of absence of tuberculosis. Your immunization records need to be updated. We have deadlines, so that means that for your physical examination, you need to obtain it within 90 days prior to the start of the program. Your testing for TB or tuberculosis is 60 days prior to the start of the program. We also require for you to obtain a drug screen test result that has to be negative, and it's an 8-panel. It has to be completed 90 days prior to the start of the program. We also require for you to obtain the flu vaccination when the flu vaccination season is in effect. And if you do not wish to obtain the flu vaccination, you can fill out a declination form. You need to wear a mask during the clinical practice once you're in the program. And that means that for the 8 hours of practice, you need to wear the mask every single time we go there. Pay attention to the requirements of the copies for each of the forms that we're asking you to complete. You also are required to obtain a malpractice certification insurance. I'm also required to do that as well, even though I may not be in the clinical practice at the time. And this will cost you around $25 to $35. For me, it's around $120, $130. You are required to bring 2 copies of your CPR card. As I mentioned before, the Allied Health 21 at Mission College qualifies for the basic life support certification, the CPR card. The forms that I was talking about is CDPH Form 283B for the CNA initial program application. We need 1 copy and 3 copies, the original and 3 copies of that you need to bring. The CDPH 283D is for the initial application for the home health aid program. We're also asking you to complete a live scan application form for background check. We do this on the 2nd day of the CNA program. We bring a certified notary, public notary, who does your fingerprints, and these are digitally sent to the California Department of Public Health. We ask you to bring a valid photo identification and social security number. Now, if you have issues where you don't have a social security number, we ask you to contact the California Department of Public Health, and you can ask them questions regarding that. I personally do not deal with the social security requirements. We also do not look into your immigration status, okay? That is not part of the requirements for this program. So you do not need to worry about those things. Pay attention that we also require for you to read the student handbook and sign off the last page and bring the original and one copy. We strongly recommend that you enroll in the health occupation courses to obtain the health occupation certification upon completion of the CNA program. This gives you a really good basis for doing well in the CNA program because it is a fast-paced program. We cover a lot of information. You're also only allowed to be absent for 1 day. And why is it that we require for you to be absent only 1 day? Is because the lecture hours are 8 hours long. So from 8 a.m. until we complete the 8 hours. And the same thing is for the clinical. So 7 a.m. until 4 p.m., you get 1 hour lunch break. And we do give you the flexibility that if you have to be absent, you can only be absent the 1 day for extenuating circumstances. So you will be able to make up the 1 day. If you have additional questions, I have my information posted here. You can contact me via email. Um, I recommend that you do not leave me voice messages in my office number because I am not available at the office due to COVID. Right now, we are not offering the CNA and HHA program for the fall due to social distancing regulations, and we are reviewing these programs as to how will we be able to offer them for the fall. So at any point where we come up with a safe way of delivering these programs, we will be notifying you via email. So you need to respond to the RSVP section for this CNA program. We have the mandatory orientation meeting here, and you need to respond to the mandatory orientation, okay? Either for summer or fall is either one, you RSVP, you enter your information, and then once we are able to offer these programs, we will contact all those interested candidates. So we ask you for you to leave that information, um, updated information, okay? And that being said, it's been a pleasure to present to you the programs that we have to offer at Mission College. If you have any questions, please don't hesitate to contact me via email, and I will gladly respond to your questions. Have a wonderful rest of the day. Goodbye.